Today is day one of at-home learning for thousands of students across the state of New Hampshire. Here to talk about many questions people have is Governor Sununu. Thank you for being here. First
Absolutely.
of all, I know you've been very busy the last couple of days. This is kind of day one of this process for 3 weeks at least of kids being at home. How is the rollout going so far?
So far it's going very well. The Department of Education has taken not just the last couple of weeks but even the last few months to really look at what this would potentially look like. What towns and districts are ready to go, what towns are going to need a little more help. Surprisingly, we have a lot of towns and cities across the state that are ready, and they're going to jump right into it with both feet. There are some districts that may have more challenges, whether it's with internet connection, but we don't have to do an internet-based remote learning. You can do analog learning with pen and paper and books and all that. There's a way to do that as well. Some towns just haven't made the investment in the infrastructure, and we can help them. But the goal is in the next few days to get pretty much everyone across the state where they need to be, roll it out over a few weeks, and then we'll reassess. I mean, we're not quite sure. As you know, this situation is changing hour by hour sometimes, and so we're going to reassess where we are in the next few weeks to decide whether we keep going forward or whether it's time to move the kids back into schools. In the meantime, we're going to have a fund set up to clean schools, for example. We want kids going back to a clean and healthy environment, give confidence to parents that that is going to be taken care of. It's being rolled out very well so far. Still a lot of hurdles to jump through, but so far it's going very well.
And we've been getting a lot of questions about people who work at businesses that aren't able to be open. We have parents at home that can't go to work because they're watching their kids. You mentioned extending unemployment benefits. What do we know about that at this point? So the plan is to roll out some expanded flexibility on unemployment benefits to take care of a few different folks. Number one, let's say you're quarantined. All of a sudden you find out that you came in contact with someone with COVID, you have no symptoms, but we're telling you to stay home for a couple weeks. Immediately, right away, not even with a buffer, we're going to allow you to apply for some unemployment benefits because, again, people living to paycheck, asking them to stay home for 2 weeks when they're not even experiencing symptoms is kind of a big ask. And so we're trying to appreciate that and provide that financial opportunity. At the federal level, they're passing legislation that allows some paid leave, which is a very good thing. We're going to look at what kind of holes, if you will, might be created with that, what constituencies might not be accounted for, and again, allow some of those unemployment benefits to be accounted for in there as well. So we should be rolling that out within the next 24 hours, make sure the guidance is clear, and whatever we do, we're really making sure we're streamlining the process so people have a very easy access to it. It shouldn't be something that they're struggling through. We know there could be a big run on the system. A lot of folks may be applying for this at any given point, so we want to make it easy for folks to get these benefits. And it's difficult to help everybody out here, but one of the things you did was extended the enrollment for daycares out there, and of course this could put workers at daycares at more risk. There's been some criticism about that. How do you balance this?
Well, again, when it comes to daycare and childcare centers, we're doing a couple things. First, we're flexing the licensing requirements. So if a business wanted to create a temporary childcare facility so employees could bring their kids to work, we're going to allow that to happen, again, in a very easy and streamlined way because we know workforce is going to be such a critical issue. We're allowing the child and daycare centers to expand the number of kids they currently have, not without limits, but within reason to allow some flexibility so more kids could be handled. We're providing guidelines to all of these facilities in terms of screening. So if these facilities, we're recommending that they do either taking a temperature or a quick survey to make sure that the kids that at least, even though they may not be symptomatic, we're at least getting an understanding of what their potential contact points might be. We have seen some states close childcare facilities. That's a very big decision because now you're really putting a lot of workforce. You're asking nurses and doctors to stay at home potentially to watch those kids because they can't get childcare for their young ones, and that again creates an exponential effect on the healthcare system. So those are big decisions we have to make, but I think by providing some guidance, by asking folks to lean in and really asking folks to understand that we are all in this together, and we need folks to really help us step up, be part of that solution, and they are. And across the state, we're seeing a lot of positivity. Folks saying, yes, we're willing to do this. If we can provide the guidance and that runway, they can get it done.
We do have a couple more questions for you. I'm going to take a quick break, though. We'll be right back.